Welcome to Saveetha Dental College lecturecast in biostatistics. This is Dr. Deepak, and in this session we shall discuss about the p-value. For example, let's assume you are trying to do a study on the microbial content of saliva. You find that 47% of the microbes are E. coli, 14% are lactobacilli, and 39% are candida. However, you repeat the study just to make sure if your results are right. But you find that the lactobacilli and the candida scores have switched completely. So now you have two studies with opposing results and you're not sure which one is right. So you need to repeat your study to make sure that your results do not change. So let's assume you repeated the study 32 times and you found that around 30 times lactobacillus came out as a predominant species and 2 times you had candida coming out as the predominant species. So if you calculate the percentage of occurrence of candida, it appears that candida would come as the predominant species in 6.25% of the times you repeat the study. Is this good enough? No. In medicine, you should have less than 5% chance of the study changing. 95% of the time, you want to be sure of your results. So you need to carry on and further proceed with the study. And if you observe that of the 44 times now you repeated, if the number of times you get candida as a predominant species still remains at 2, now your percentage of occurrence or percentage of chance that your lactobacillus will not come as a predominant species falls below 5%. If the study results are consistent more than 95% of the time, it is safe to assume that the results are valid. In this case, there is a 96% of chance of getting a blue square over an yellow one. So you should remember that the p-value denotes a chance that your study results will vary. It does not give any information of the quality of bacteria or any clinical finding. P-value only tells you that what are the chances that you are wrong in your study, or what are the chances your study results will change if you repeat the study. For example, if the p-value is 0.1, it means that there is 10% chance that your study results are likely to change. Hence, in medicine, if the p-value is less than 0.05, then we assume that treatment will work 95% of the time, and this is good enough to recommend for clinical usage or clinical practice. With that, we conclude on p-value and hope you have a nice day. Thank you.